Bismillahirrahmanirrahim. Assalamu alaikum. Love of beauty is taste, the creation of beauty is art. And this is what we all dermatologists try to do to create beauty. So today I am going to present a comparison of microneedling versus glycolic acid chemical peels for the treatment of acne scarring. We as dermatologists often tend to forget the simpler things. But in my opinion, simpler things, if they're done properly, they can have amazing results. And being a supervisor, it's my message for all of the residents, the future dermatologists sitting here, to start buying these inexpensive instruments, dermapen, keep a supply of the peels, and start doing it while you're training. So by the end of your training, you will be well versed with all these procedures, and when you can in the market में आने से मेरा मतलब है जब आप इंडिपेंडेंटली प्रैक्टिस करना शुरू करेंगे तो आप अपने कॉम्पिटिटर से अच्छी तरह से compete कर सकेंगे. And I believe that aesthetic is an integral part of the training of any dermatology residency. So I am working as assistant professor of dermatology at Rawalpindi Medical University. This is my institute from where I graduated, and where I'm sitting today is because of this institute. This study found its way into an international journal, and it's published in last year, and you can read the whole article on PubMed. So acne vulgaris, as we all know, it's a common skin disease. It affects about 9.4% of the global population, making it the 8th most prevalent disease worldwide. And not only it leads to physical disfigurement, but it also has a profound psychological impact. Acne scars can be atrophic and hypertrophic. In atrophic, we had ice pick scars, rolling scars, and boxcar scars, and our studies about these 3 types of atrophic acne scars. There are different treatment options available for acne scarrings. One of them is chemical peels, and in a chemical peel, you all know that we apply an ablative agent to the surface of the skin, and basically we introduce keratolysis or keratin coagulation. And that results in a controlled destruction of epidermal and dermal sections and subsequent exfoliation. Microneedling is a relatively new procedure in which we use fine needles to puncture the epidermis, and that stimulates growth factors and collagen production, while the epidermis, it remains intact. So, why we did this study? Because we found that there is lack of data comparing these 2 studies directly, and especially in the skin of color. Skin of color में हमारा सबसे बड़ा जो नाइटमेयर क्या होता है किसी भी चीज़ को ट्रीट करते हुए कि आप एक्ने स्कार्स को ट्रीट कर रहे हैं, उनकी डेप्थ भी कम हो रही है, बट द पेशेंट कम्स अप विद पोस्ट इन्फ्लेमेटरी हाइपरपिगमेंटेशन, और वो हमारे लिए एक नाइटमेयर होता है जब पेशेंट आके कहता है कि जी अब तो निशान पड़ गए हैं. बेशक वो टेम्पररी हो, but that is a nightmare for a dermatologist. So to prevent this, we did this study and to see कि skin of color में क्या options हो सकती है acne scarring के लिए. So our objective was to compare microneedling with 35% glycolic acid peels, and we took, as it was a randomized control trial, we took 60 patients with Fitzpatrick's skin type 4 and 5, and we randomized them into 2 groups. Group A was of microneedling group, and that was done every 2 weeks for a total of 12 weeks, and Group B had chemical peels every 2 weeks for a total of 12 weeks. And we used the famous Goodman and Barron scarring grading system to compare our results, and improvement in grading from 1 grade to the baseline, it was considered as the efficacious. So this is that scale that we used. We analyzed the data in SPSS 25, and we used the chi-square test to compare the efficacy of both groups. Coming towards the results, we see that most of the patients in Group A was 15 to 40 years, but in Group B, most of the patients were of 41 to 50 years. Male and female distribution was almost the same in both the groups, that the most of the patients were females, that is around about 70%. So if we talk about the efficacy, according to the type of acne scar, we found that in auspic scars, the Group A was the microneedling group. So you can see that most of the patients in Group A, they were having good results as compared to Group B, right? Same was the case in boxcar scars. Microneedling group showed amazing results as compared to the glycolic acid peeling group. And in the rolling scars, we also found the same results. And in rolling scars, the microneedling group, all the scars improved. There was 0 patients in the non-efficacious groups. And if we talk about the overall efficacy, what we found is that microneedling group, we found 73.3% patients had efficacy in their acne scars. But if we talk about the glycolic acid peel group, only 33.3% patients, they showed improvement in their acne scarring. So these are some of the results. This patient is from glycolic acid peel group. Another patient from glycolic acid peeling group. These are the results of the microneedling groups. And this is another patient, and she showed amazing results. So what we found in our study, that we found that microneedling therapy, tends to be significantly more effective in lowering atrophic acne scars than 35% glycolic acid peels. And our study population was predominantly Fitzpatrick skin types 4 and 5, which are the darker skin type जो हमारी population में बहुत ज़्यादा मिल जाती है. जब हम literature की बात करते हैं, हम किसी भी modality की बात करते हैं, तो हमें अपनी skin type पर बहुत कम data मिलता है. So I would encourage all of you to do more and more researches, especially in our skin types, ताकि हम अपनी skin types पे एक literature बना सकें और फिर उन्हीं को guidelines में लेके जा सकें. The good thing about microneedling was that it offered a more desirable safety profile in the skin of color, and because it keeps the epidermis intact and the retained skin barrier, it promotes recovery and also limits the skin of risk of infection. And it is also, because if you talk about the carbon dioxide laser, it can also be done in the acne scarring, but that can thermally activate melanocytes, which can lead to hyperpigmentation. There was another study which was done on different skin types of microneedling, and it showed that there was no risk of hyperpigmentation in any of the groups in which the microneedling were done. And that is ideal for our skin type, because our biggest fear hota hi hyperpigmentation. So our study not only parallels the study findings in darker skin patients who had better outcomes, but it also suggests that microneedling can be a better option for acne scar treatment in patients with skin of color. So our conclusion is that it is a better option than the 35% glycolic acid peels, and especially in darker skin types, that is the skin types 4 and 5. But of course, future research is required by all of you sitting here so that we can have our data on our own skin types. Thank you very much. So these are the references.